You're listening to The Real Deal Conversations, a podcast designed to encourage, inspire, and equip you by sharing real stories and meaningful conversations that bring real life to the surface. I'm your host, Megan Deal. Let's dive in. Today, my guest is Dr. Amit. He is a child and adolescent psychiatrist. He specializes in ADHD and autism. And so he's going to come on and we're going to talk today all about ADHD and autism and how we can bring awareness for people who are diagnosed to empower them in their diagnosis and bring awareness to people who don't really understand ADHD and autism so that we can be more empathetic and kind towards people that may be different than us. And also for parents who are trying to navigate helping their child and empowering their child with ADHD and autism. And just hopefully we can give you a well-rounded view. We're not going to be able to hit everything, but we're going to do our best. So Dr. Amit, thank you for coming on. Do you want to tell us a little bit about yourself?
Hi, my name is Dr. Amit Jagtiani. I'm a child and adolescent psychiatrist. I'm originally from India. I was trained in psychiatry in India and I came to the United States in 2017, finished my trainings in adult and child psychiatry, and now I'm practicing as a child and adolescent psychiatrist, and I specialize in ADHD and autism.
Great. Well, thank you so much for coming on. So let's start with just kind of telling us, what is ADHD?
So ADHD is a neurodevelopmental disorder. So what that means is that it affects the developing brain, and by definition, it has an onset before age 12. Mm-hmm. And it affects children as well as adults. The origin is before age 12, by definition.
Okay, and how is that tested? How is it diagnosed?
So I think first it's important to know what ADHD is actually about, mm-hmm. and then we can talk about how it is actually tested and diagnosed. A little bit in detail about ADHD, which our listeners should know, is that I essentially describe ADHD as a disorder of self-regulation, self-regulating focus, movement, emotions. By definition, emotions is not a part of ADHD, but you would see that this is an essential component of ADHD in clinical practice. So to understand that, I think we should understand a little bit about the development of brain, the normal development of brain. Mm-hmm. So when a child is born, they do not have any control over their focus, their movements, and their emotions. Mm-hmm. And as they grow, especially in the first 5 years of life, you see a lot of development in those areas. Mm-hmm. So a child is born, cannot focus, and is constantly shifting focus, and then they gradually learn to focus. By the time they are like toddlers, you still see them like jumping from one activity to another, and they have a very short attention span, mm-hmm. and they are constantly moving, jumping, climbing, and throwing tantrums. And then by the age of 5, they develop good enough control over these processes, and then by then they're ready to go to school and sit and focus in their classrooms and not throw tantrums and not have emotional outbursts there. Mm-hmm. This process of development starts from the beginning and it goes on. Like even in adolescents are in general, they are impulsive, right? Mm-hmm. So the brain is still maturing and this process goes on till age 25. That's when we say, okay, this person is now mature, mm-hmm. right? That's what we call the maturity. Mm-hmm. So this normal development process does not happen the way it should in some people. Mm-hmm. For a variety of reasons. It could be genetic reasons, it could be environmental reasons, birth complications, hypoxia during birth process, or different complications during the pregnancy. And mm-hmm. So all that can affect this normal development. Mm-hmm. And some of these kids just struggle more. Mm-hmm. So by the time they enter school, they're still struggling with focusing. Mm-hmm. They're still struggling with their movements and their emotions. So how does it manifest? How does it look like mm-hmm. in that setting? That's very important. So if a child who is struggling with focusing, they usually will have a short attention span, right? And they would be easily bored. They will be jumping from one activity to the other, and they get distracted easily. They have trouble listening, following through instructions, completing tasks, especially like multi-step tasks. If you give them a complicated instruction, they will do just one or mm-hmm. two of those things and then forget the rest. So these kids are often forgetful. They lose things. They misplace things a lot. And they don't pay attention to details. They tend to zone out in conversations. So they are often like daydreamers kind of. And the problems that it causes is like in the classroom setting, if they are not focusing, so they might be doing other things. So they might be talking, or they might be like tapping the pencil on the table, or they might be making random noises in the classroom, which disrupts the class, right? So these problems start to appear when they go to the school.
The tapping the pencil, the tapping your leg, making noises, is that to help them focus, or is it because they're bored?
Both.
Okay, so that's kind of a conundrum, because if we want our kids to focus, they're doing what they can to focus, but then it disrupts the class.
Yeah.
So that's kind of a double-edged sword. So what would you say to a teacher when a child is trying to focus and what they're doing is disrupting? How can we help a child still focus and it not be disruptive?
So I usually tell them, like, if they need some fidget toys that are not disruptive. For example, I have a ring in my office that it's a magnetic ring. You can put it on your finger and you can just like twist it, like turn it around. So it doesn't make any noise and they can still fidget with it. So it doesn't disturb others. Something of that sort can be helpful. I've seen teachers giving some of these kids like movement breaks to release their energy and all that. So some of those things come through 504 plans, and we'll discuss that as we talk about these things.
But I think that's really good to know for people who think that children are just, I mean, teachers understand because they understand diagnosis and stuff, but for people who are like, oh my gosh, that child in my daughter's class is so disruptive and just so bad, I don't really think that's it. I think he's doing or she is doing what they can to survive the moment. And it's coming out in a way that it is not like what your child is doing. So, I think it's important to understand that.
Yeah. And I think there's also another component of inattention, the difficulty focusing. And that's also a difficulty with the executive functioning in these kids. And these kids are usually very, very disorganized. So the self-organization difficulties appear in the form of they are struggling with completing their assignments, finishing them on time, the time management of things, keeping their room tidy. So their rooms are messy, their desk at school is messy, school bag is messy, they just shove things in it and like don't really like organize things. So that disorganization shows very prominently in their lives.
But don't you feel like they know exactly where everything is?
Yes, I hear that. So I hear that as it's an organized mess.
You should see
This is the term that parents use. It's an organized mess.
It is. And it's funny because that's me. And my husband is not that way at all. And in my office, you should see my office. But I know exactly where everything is. I know exactly where everything is. And if you try and organize it, it's going to screw me up. Yeah. Don't touch my stuff.
Yeah.
It looks crazy. It looks chaotic.
Yeah.
But I know where even the tiniest thing is located. So
this is one component of ADHD. We were talking about like different ways in which ADHD affects our life. So one is difficulty with focusing. The other thing is hyperactivity and impulsivity. So it can present in very different forms, ranging from just like some fidgetiness to hyperactivity in the form of like running around, bouncing off the walls, that kind of hyperactivity. Impulsivity can present in different forms, like intruding into others' conversations, blurting out, and difficulty waiting for one's turn. And as kids grow, like these can also present with like very impulsive behaviors, impulsive aggression, impulsive substance use, impulsive eating, obesity. How much it affects their lives in different forms as they grow into adults, like gambling. All these are problems with impulsivity, impulsive sex, teenage pregnancies. All these things like could be a consequence of ADHD.
Is it a lack of dopamine? What is lacking in the brain that is keeping them from being able to not be impulsive?
Yeah.
What is that?
That's the entire hypothesis behind ADHD. The dopamine and the norepinephrine levels are lower in their brains, and the medications that we use for ADHD are typically the ones that boost the levels of these neurotransmitters in the brain.
And so when you want to interrupt a conversation, the impulsivity, what is it? Like, do they think that they're about to just not be able to get it out, or they're going to forget, and so they just have to get it out right then and there because they're like, oh, I'm going to forget what I'm about to say? What causes is that impulsivity
That's
to do all of that.
Impatience trait, right? Where like, if I don't say it now, I might forget, or like just can't hold their impulse. So it just comes out. Like they just don't have that filter, the stop mechanism of like, okay, let me pause here and let this person complete what they are trying to say.
So how does ADHD present different in boys and girls?
It's different, yeah. So boys present more with hyperactivity and impulsivity. Girls have more of inattentive presentation. I did not touch base upon like this different kind of presentation. So we were talking about difficulties with focus, difficulty with hyperactivity, impulsivity, and emotions. We'll talk about emotions more later. But typically the ADHD is of 3 types: inattentive type, hyperactive impulsive type, and combined type, which has like both inattention as well as hyperactivity impulsivity. So boys have more hyperactive impulsive kind of presentation, and girls have more inattentive presentation, and that makes it so hard to diagnose ADHD in girls, because if they're not running around, people will be like, okay, they do not have ADHD. And especially like girls and smart kids with high IQ who are not very hyperactive impulsive, it's really hard to diagnose, identify it in time. I usually get these people either towards the end of the middle school years or early in the high school years, when they start to experience main problems. So these are in fact like 2 high risk periods in the lives when many kids with ADHD get diagnosed. In fact, there are 3 high risk periods. One is when they enter school. Many of them get diagnosed around that time, especially the ones that are more rambunctious. And then when they enter the middle school, and then when they enter the high school. The reason, because anytime there is a complexity in the curriculum, their defenses just like fall apart, and then they start to present with difficulties.
So when they're older, what is it that starts to present, that starts to make it more obvious where it wasn't before for girls?
The focus problems. You would see that these girls, or in general anyone who has the inattentive type, they did well mostly in the elementary school years, because there were like more supports, and like teachers were lenient, and like they were giving more one-on-one help to these kids. As they enter the middle school, that one-on-one help is no longer there. So now they start to struggle more with their focusing. They seem lost in the classroom. They cannot grasp what the teacher is teaching, and their grades start to decline. And then they are bored in the classroom, and then they are again same kind of behaviors, like they are not listening and doing other things, talking, disturbing the class. So all those things become very apparent, and parents are concerned when the grades start to slip.
So in high school, I failed so many of my classes because I couldn't focus. We were one of the biggest high schools in the area. We had very large class numbers, and I could not focus for the life of me, but I never wanted to get in trouble. So I would do everything possible to just go under the radar, because I just don't want to get in trouble. But my grades were slipping and failing, and I couldn't focus. I couldn't, even if I wanted to focus, even if I wanted to try, it wasn't there. So then my sophomore year, I went to a private school where the classes were 5 to 6 people per class, because it was very small. And all of a sudden I had straight A's. And come to find out, I am highly intelligent.
Yeah.
But after that year, it was a very expensive school. My parents couldn't afford to keep me there the rest of high school. So then I had to go back to the high school that I had failed at in my freshman year. And so then my junior, senior year, it went back to failing grades. And I think it's frustrating for people. It's frustrating for people when you're in a school environment that is catered to a neurotypical brain. And if I wouldn't have gone to that one school to find out that I actually can make good grades, it's low self-esteem, it's very hard to feel good about yourself when you're in an environment that is not catered to helping you understand how smart you actually are.
Absolutely. I think you brought a very important point here. The way you described how you were intelligent, but you were still struggling in the school. And that's because you were scattered, you were disorganized, you were not able to focus. That's ADHD. Most people with ADHD have a very good IQ. They are smart people, but they're scattered. Because they are disorganized, they just cannot function to their potential. And the way you described how going to a private school with the smaller classroom, that's essentially what happens with ADHD. If you give them more one-on-one attention, they thrive. These people thrive in smaller settings. So I always tell my patients that, like, if you're struggling, ask for smaller classrooms. So typically, some school districts have smaller classrooms, special programs where They don't have to do an IEP. They just like send these kids who struggle in bigger classrooms into those smaller classrooms. But many school districts do not have those kind of programs. So they would do an IEP, and because IEP classes are smaller classes, right? And that's always like a struggle with the school. Like, oh no, your kid is very smart. They don't qualify for an IEP. Mm-hmm. But like this kid needs smaller setting to survive.
Right.
So one-on-one tutoring and smaller classes, that's what is required.
Mm-hmm. Yep. And I think because the school system, just in general, caters to the neurotypical brain, do you think there's ever going to be a way that public school can cater to both without it being a hassle in the school's eyes?
I think school wants to help these kids. It's just that they don't know how to help them. We know it very well. They need smaller classes, right? But the process of an IEP, schools find it very cumbersome. So they don't want to do it. They will make all excuses to avoid an IEP. So I think schools needs to be educated that like this is a way out. You don't need to do anything special here. It's just that they need more one-on-one attention in smaller classroom. So the way some of the school districts have implemented it is like providing these smaller classes without having to do an IEP. I think that's the thing. And everyone should be on board with that. Most of the times it works like that. And even after that, if a person is struggling, then yes, we have to find out why the kid is still struggling, and then what else we can do. Does the kid need more one-on-one rather than a smaller classes, or like the person needs to be in more special education classes?
Do you think depression and anxiety is higher in children with a neurodivergent brain because they are constantly put in environments that do not cater to the way they understand the world and learn? And so depression and anxiety goes up because they feel this extreme need to fit in, yet they can't fit in because of what's going on, or this extreme need to excel because your grades are bad and now parents are unhappy, or your grades are bad and now you're not getting awards like the people in your class. And there's this constant hamster wheel to catch up with the rest of the world, but your brain, it doesn't work like that. It doesn't allow you to catch up with the rest of the world. Yet, when you get out of school and you start to understand how intelligent you are, just in the areas that your brain works in more, like Elon Musk, the Elon Musk of the world, you know? So do you think that's why we have some higher depression and anxiety rates, and even possible suicide rates because of all those factors combined?
Absolutely. I think you just said it all. Let me explain that to you. So ADHD typically starts with focusing difficulties, hyperactivity, impulsivity, behavioral problems in the classroom, at home. And these kids are always getting into trouble for that, right? So how it progresses is that they start to internalize it. Everyone is telling them, you did this wrong, you did that wrong. And being in trouble all the time, they start to internalize it, and they start to develop more and more of anxiety. So they are like, okay, I can never do things right. They start to engage in that negative self-talk. I'm stupid, I'm bad. And then it progresses. Like as they internalize it more, it's like it progresses on to like full-blown anxiety and depression. And then like they want to do good. Like these are smart, intelligent kids who might have done very well in earlier stages like of their school life, but as it became more complex, they started struggling more. So it starts to affect their self-esteem, and they develop more of like depression. And you see that very common in teenage years. By the time they reach teenage years, they are depressed, and then they kind of find no hope. There's no help that's available, and then they become suicidal, and they have suicide attempts, and then still there's no help available. So they either self-medicate themselves with substances. So that's how it progresses. So we have to identify it early and treat it early so that it does not lead to those complications.
We have, in the town that we live in, there is an alternative high school, and I am so thankful for it, because that alternative school has smaller classrooms, and it's for the students who are struggling to graduate, because some of it is circumstances outside of their control, not diagnosis. You know, it's just extreme at-risk circumstances.
Yeah.
But some of it is diagnosis that it keeps them from the executive functioning. It keeps them from the organization skills to be able to thrive in a normal learning environment. And I would love to see, and I know I'm a big dreamer, but I would love to see all school districts have an alternative learning center so that the ones who feel like alone and stupid and hard on themselves, that actually are not any of those things, can thrive.
Yeah. I will also mention that as a self-disclosure. I was born and raised in India, so there's no concept of ADHD in India.
Yeah.
I'm myself self-diagnosed ADHD.
Yeah.
I've never been diagnosed formally. But I know, I struggled in my middle school years, just like the way we are talking, and nobody recognized it. And I was so good. I was so intelligent. I could thrive if I was learning by myself and I got one-on-one. My mom taught me throughout, because when she saw my grades slipping, she started giving me one-on-one attention, and I thrived in that. The school environment is so rigid. They wanted you to do this and this thing today, and this and that thing tomorrow. I just can't function with that like that. I do things at my own pace, and what I would do, I was hyper focusing. I used to pick up one subject, read it from the beginning to the end, one full month, one subject, done and dusted, next subject. So you see how I was doing it by myself, and I was thriving. I was still the best performing kid in the class, though I was so scattered but I was creating problems in the class because I just could not survive with that schedule and routine that the school had for me. So that's what I think what we are talking about is an alternate school where kids can get the freedom to learn at their pace and the way they want to.
And it's smaller classrooms. It really is catered to the neurodivergent brain. And I'm going to say it again, I am a dreamer, and I think every district at some point in the future should have an alternative school for learning. And our district, I commend them for doing that for our students because it's incredible. So rejection. Why does rejection feel intense for people with ADHD? Is that an ADHD trait, or does it just happen to be common in people with ADHD?
So I think there is definitely a trait there. In the beginning, I mentioned that ADHD is a disorder of self-regulation, right? It's a disorder of self-regulating focus, self-regulating movement, and also emotions. So you would see this very often in ADHD kids that they struggle with emotions in general. They are more tantrumy. They have more outbursts, they have anger issues, and just regulating their emotions is hard. They have a short fuse. Once their emotions are triggered, it's hard for them to calm down. They might take 10, 20, 30 minutes, an hour, 2 hours to calm down. So in general, regulating their emotions is very hard for them. And as they keep getting into trouble because of their ADHD related difficulties, everyone is telling them hey, you did this wrong, you did that wrong. So again, they are kind of always rejected by people, right? So they develop that rejection sensitivity. So anytime somebody tells them you did not do this wrong, it would not automatically trigger an emotional outburst in them.
So with rejection and having that sensitivity, how do we help them with their emotions? How do we help them with that rejection? How do we help them work through that?
So there's no magic medication that can help them with that. So it has to be a mix of approaches there. We have to help them regulate their emotions better. So that essentially I'm talking about therapy. So there are different kinds of therapies that could be offered to them to help them get a better control over their emotions and develop a more positive view of themselves, improve their self-esteem, improve some of the depression and anxiety that they are struggling with. So all these approaches would eventually help them regulate their emotions better and feel less of rejection in those situations. And if at some point we need to take some help from the medications, I think there are some medications that can help with emotions as well.
So I work for Big Brothers Big Sisters, and it is a one-to-one mentorship program. And a lot of the kids that we do our one-to-one mentorship with in the schools have a diagnosis. And so that one-to-one, I think, is so helpful because of what you just said. It's one-to-one focus time to help them build that self-esteem. It's not, nobody wakes up one day and says, I just can't wait to get in trouble at school. I can't wait to interrupt my teacher or interrupt my class and make everything hard for everybody. Nobody wakes up and does that. It is the way some people's brain works. And when you have that one-on-one attention, and so you're right, it's that one-on-one time to help them build the self-esteem, to counter all of the negative things happening, to counter all of the risk factors in their life, and to give those kids that one-on-one. And even if it's just a teacher coming alongside and saying, I know you're trying. I see you trying. I know today wasn't great, but I saw that you at least tried then. And it's countering those negative thoughts, because I think negative thoughts for people with ADHD, they're really held on to, and it becomes an obsessive thought that you can't break. You can't break the obsessive thought, and you replay it over and over and over again in your mind. And I think that's also adding into depression and anxiety with people who have ADHD and autism, because they're replaying those negative thoughts over you can hear 10 positive thoughts and 1 negative thought, and I will obsess over that. And I've learned different techniques to break the thought, but we have to teach our kids those techniques too. We have to teach them those techniques to break the thought, to break the obsessive thought, the intrusive thought, and help rewire their thinking.
Yeah, absolutely. I agree. I just love what you said about, like, even if like one teacher can identify that and say those positive words, that would make a huge difference. Mm-hmm. It was same in my life. Like at a point when I was like, I had no confidence in my abilities, there was one teacher who came and was always like, I don't know what she saw in me. She was like, I know you can do it. Like, are you working hard enough to do this and that? And I was like, okay, is she stupid? Like, doesn't she think that like, doesn't she know like I'm struggling academically? Yeah. And just that encouragement, I was like, okay, I have to live up to those expectations. Yeah. And I just started working hard and extra hard than everyone else around me. Yeah. And I thrived.
I love that you just said that. So people who have rejection sensitivity, are they more prone to become people pleasers in order to avoid the rejection?
Yes.
Which is toxic.
Absolutely. Yeah, I think you're very right in saying that these people often become people pleasers. Mm-hmm. And you would see that very often in ADHD kiddos. Like, they don't want to get into trouble and they don't want to mess up things. So they stay quiet in the class. They do like whatever is expected of them. And they develop that kind of anxiety in them, like they might mess up. So they are quiet, they don't talk much, and they don't get into trouble at school, but that anxiety keeps building up in them. So they are just full of anxiety by the time they come home, and then they just let it go. And you see all the behavioral problems manifest at home, where they are irritable, they are tantrumy, and they have all these emotional problems at home. And when you ask the teachers, he's a perfect child. Mm-hmm. Mm-hmm. So you see that typical pattern in these ADHD kiddos.
That's my 7-year-old. And it's hard because he does do well in school. He's really good at it. He's really good at not getting in trouble and wanting to follow the rules. And then as soon as he comes home, it is 0 to 100 until his eyes close at night. And it's hard for a diagnosis, because one of the things is going to be, well, how are they in school?
Yeah.
Well, he's good, but he also tells me that, it's really hard for me in a certain subject. It's really hard for me to focus because there's noise going on, and then it makes me really angry because I'm trying to focus and I hear the noise. And so I see things also because of just understanding it just from a personal view. So I see things, but then when like talking to my husband, I'm like, we really need to start working on seeing if he needs to get a diagnosis. But, it's, if you don't understand it, which is part of the reason I want to have this podcast for people who don't understand it. If you don't understand it, but you hear what, you just said about kids with ADHD can people please throughout school, and then it all comes out in the evening. So with a diagnosis, what would you say to people who are fighting getting it? It's harder for them to get the diagnosis because nobody in the school is seeing it.
I see this very often. Mm-hmm. Many of these kids, because the part of the evaluation is like you get an input from the school, from the teacher, and then an input from the parent. You look at the parent input, it looks horrible. You look at the teacher input, it just looks pristine. Mm-hmm. So in those cases, I hold off on giving that diagnosis, but I start exploring anxiety, right? And when I see that there's a lot of anxiety, I start treating it. And once the anxiety is treated, then you see the florid ADHD come up in the school as well.
Interesting.
And then you get an input from the teacher, and then you realize, this is ADHD.
Interesting. So the anxiety is what is causing them to people please and stay good and stay still.
So it's the anxiety that builds up. They want to be good. They want to please everyone, and they don't want to get into trouble. And they just hold on to those urges, the impulses, and everything. And they don't act out in the class. They don't say anything to get into trouble. So the entire day they are busy. Their minds are working to kind of self-regulate in the moment. And this is an active self-regulation that they are doing voluntarily in the moment. So it just burns them out. It builds up anxiety all through the day, and it burns their mind. And then by the time they come home, they just can't take it. And this is their safe space now. Home is a safe space. Mom is a safe space. So they just let it out, and it's like all aggression, irritability directed towards the mom.
So I know people are going to listen to this and say, so what you're telling me is they can control it. And that's not so, because when we say that they're impulsive and they can't control things, and then we say, but in school, we have kids who are, and it develops everything we just said. So what do you say to the people who are like, well, clearly they can control it. So do we really have that big of a problem?
So I'll rephrase it in a different way now. So most of us can control our urges and we can control our behavior, and we don't have to think consciously about that, like, okay, I have to control my behavior now. We just do it naturally, right? We don't have to spend an extra energy of our mind to self-regulate ourselves. But these kids have to spend that extra energy every single moment to stay regulated. So that's what I'm saying, that wears their mind, and like they're exhausted by the time they come home because they were just busy self-regulating all through the day, hyper-focusing all through the day to learn and stay focused, and they just can't do it anymore. Now they're in their safe space. So this is the difference there.
Which I would also think wears out, it exhausts them, and so we're wearing down the brain. And when our brain is exhausted, our mental health isn't functioning as well. And so when your mental health isn't functioning as well, I mean, the brain is it. People think that mental health is like, oh, well, you must be crazy. The brain, if you break a leg, you're going to cater to it. If your brain's exhausted, or let's say you don't break a leg, but you run for 2 hours, you're going to be exhausted and you're going to need to sit and take a break. It's the same thing with the brain. I mean, it just needs a break sometimes. And so if you're in that constant state and your brain doesn't get a break, again, higher rates of depression.
Absolutely.
Higher rates of suicide, especially when you don't have the community support of understanding all these mental health factors. And so it's like, oh, you're fine. It's a thought, or it's fine. And we keep pushing it all to the side because we don't understand how to help these people. Depression rate gets higher. Anxiety gets higher. Somebody asked me one time, why do you think our suicide rates are so high in children? And I do think that these are some of those reasons, is there's factors that keep pouring into that depression and anxiety, and we're not effectively helping those kids because we don't know how, or we just don't believe it exists.
Absolutely. There are many people who believe that ADHD just does not exist. I'm telling you, I was telling my story, like I grew up in India. Nobody knew anything about ADHD. So naturally, we did not talk about, but that does not mean that I did not struggle. It's only now that I recognize that, yes, that was ADHD. And there were consequences, like it's different than this country where like you cannot impose these consequences. And so I had everything where teachers insulting me, like beating me up, like slapping me in front of the class, everything, you name it. Like I got all the consequences, but the problems were still there.
Right.
It did not go away.
I like that you just said the problems were still there. Denying that ADHD exists doesn't cure ADHD and all the people that have it. Saying that it doesn't exist doesn't take it away from that child. And saying, well, all of this is because a lot of people say it's not ADHD, we just have an electronic problem. And yes, we have a problem where we've scrolled so much, our brains are used to everything happening quicker. Okay. But to assume that these things aren't actual issues, and to just say, well, they need to get off electronics, or their parents just need to parent better. I hear that a lot. Their parents just need to be a better parent. They can't open up their brain and fix there's so many things that we automatically assume instead of just looking at the issue. And I don't know why that is. Why do people choose to stay so ignorant to it? Why is that?
I think it's just like people are not aware, and as people are learning and they are recognizing that yes, this is a neurodevelopmental issue and it has nothing to do with bad parenting or anything. I think people are accepting that diagnosis, and social media is playing an important role in bringing awareness to this disorder now. And that's why you're seeing a rise in the ADHD diagnosis these days. The estimates are like roughly 10% children and adolescents in the United States have a diagnosis of ADHD, and these figures are much higher than other countries, the European countries, and I think the reason is just there's more awareness now. So definitely we are moving in the right direction.
Yeah. So talking about more awareness with social media and like scrolling and having that, just everything is so quick. Everything is 15 seconds. And so we're getting used to things being in smaller. So when someone does say, I don't think my child's ADHD, I think he just has adjusted to our world being quick, everything being very fast and our brains adjusting. How much do you think our brains have adjusted to that? And then how much do you think is just ADHD finally having more awareness?
Yeah.
How much is exposure to the world changing, and then how much is actual diagnosis?
Yeah, I think the actual diagnosis, the neurodevelopmental issue, I think that's very real, and like that does not change. It might change for other reasons. For example, environmental exposure to certain things, exposure to drugs during pregnancy, and if that's like is contributing. So that could be one reason why like the rates might be increasing. But I think in general, the world has gotten very fast paced, right? And we have to juggle 100 things at a time. So naturally, it will exhaust our resources, the resources of our brain. So we will definitely feel lost and like unable to cope with some of those things. So I think that's the difference. If you see, a lot of adults start to experience that they did not have any problems earlier in their lives, but now as adults they start to experience that and they wonder, do I have ADHD? So by definition, that ADHD that we call as a neurodevelopmental problem, they might not have that because they were doing fine early in their lives before age 12, but now as they grew older and they had 100 things to do, they start to experience that decline. So yes, I think there is a contribution of that as well. Are kids also doing 100 things at a time now compared to, yes, likely, and it might be exhausting. So I to answer your question, I think both the things are contributing.
And so let's kind of finish up school. Why do children with ADHD struggle to make friends?
Yes, that's another domain what affects ADHD kiddos. Social struggles are very real in ADHD. These kids struggle with making friends or keeping friends. Making friends is still not a big deal. Most of them are social and they can make friends, but just because they are so rambunctious and like they might play rough, loud, and might get aggressive during play. So many people, like many kids, would not want to play with them. So they lose their friends. Sometimes kids with ADHD have subtle social difficulties, like they can be a sore loser or they might be very bossy in their play. So kids don't like that if they don't play like the way, if others don't play the way they want them to. And these are subtle social skill deficits in these kids. We were initially talking about the ADHD and autism. So some of the autistic traits you might see in ADHD kiddos as well on a very mild level. I think roughly 25% of ADHD kids have subtle autistic traits, and it could be other traits as well, like difficulty with social cues, difficulty respecting personal boundaries, and difficulty having a good back and forth communication. They might just want to talk about what they want to. So those subtle difficulties, but they would not qualify for a full diagnosis of an autism spectrum disorder. But there's still a very high comorbidity between the two conditions.
So a lot of the things that you just mentioned are things that boys do a lot who have ADHD. What about girls? Why do they struggle socially and with friends in ADHD? The girls who don't have the wanting to wrestle and do all that. What's their struggle in friendship?
Other than being very rough and loud in their play, I think the other subtle social skill problems that I just mentioned, I think girls would struggle with very similar issues. It's no different for girls than boys, other than they are not usually as loud and disruptive.
When it comes for parents, what are the most common stresses and support needs that you see from parents of a child with ADHD? And what advice do you give them? So
stresses, I think there are stresses at school and at home. At school, these kids often struggle with academic problems. they struggle with behavioral problems. Academic problems, these kids struggle with learning. Usually everything, like they just struggle in everything. So they have poor grades, they struggle with completing their assignments, submitting them on time, meeting deadlines, and they hate school. So there are a lot of like learning problems in these, and that causes a lot of stress. And then behaviorally, they are impulsive, they have impulsive aggression, they might say things or do things impulsively that gets them into trouble, can often lead to suspensions. So that is typically the major stress at school. So school is always like they don't want to go to school. And at home, they struggle with procrastination, and they have difficulty with chores and keeping their room clean, and they struggle with self-care. So they might not shower for days at a stretch, and like the parents have to always like keep fighting with them to do these things, take a shower, brush your teeth, and like this is a constant like conflict with the parents, and sometimes it starts to affect their relationship with their parents. Often these conflicts lead to like significant problems in their relationships.
And so what advice do you give to parents when they're facing that and they're at their wit's end? What advice do you give to them to navigate that?
So I think first it's important for the parent to recognize where is it coming from. Unless they have a clear idea like why does their kid struggle with these things so much, they would never understand. They would always label their kid as lazy.
Even with a diagnosis, even when they know their kid has a diagnosis, it's still easy unless you understand the root of all. Because when you ADHD, it's for a parent, it's a lot to learn. It's a lot to understand. Oh, so you not brushing your teeth is part of your diagnosis, and there's a lot of things that you learn on the way. So
parenting these kids is different. It's harder than the regular kids. They need special strategies to address this. They have to understand that their child is usually forgetful. You tell him to do something, he will kind of listen to it, but then might get distracted and might forget that he had to complete that task. So having that in the mind, the parent has to understand, okay, if this kid needs like multiple reminders, I have to give this. And if like the kid is struggling with procrastination, then how can I minimize that? Like there are different strategies that can be used. So if something can be done in less than 2 minutes, it should be done now. So helping their child with these strategies, and like if cleaning the room is a chore and the kid is constantly procrastinating that, then maybe setting a specific time for that. Like every Saturday 6 p.m. you have to clean your room. And then you set up an alarm or something to remind you around that time. So those kind of like different parenting strategies to help their child with that. I think that's necessary there.
Why do children with ADHD struggle with that? Like doing chores, cleaning your room. What is the mental process that is keeping them from seeing that and making them angry to do it? What's the mental process there?
There are a couple of things. Firstly, they find it overwhelming. Where should I start? How should I clean this? The executive dysfunction. What should I clean first and what should I clean next? And how to because everything looks so much to them. And then problems with their time management. So what happens is that these kids struggle with time blindness. So they might overestimate or underestimate time. So let's say cleaning the room takes 10 minutes. For a normal person, for a parent, it takes 10 minutes. The kid would think, it was going to take 2 hours and I can't do it. That's the response. So they're not saying that, but in their mind, it's like, it will take 2 hours. So, but if they actually start to do it, then they would complete it in 10-15 minutes. Yep. So that's the problem. Like they would find it really hard to start the process, that inertia of starting. So it's always good to help these kiddos, give simple tasks to them. Instead of go and clean your room, if I tell the kid, go and pick up the clothes from your room and put it in the cupboard. The kid has a very specific task in mind, right? So that's going to minimize that overwhelm. Just being there, just giving instructions once the kid is done, like cleaning the clothes from the floor. Okay, now time to pick up your toys. Right. So the parent should be there giving instructions there.
Why does body doubling help in executive function? So having somebody next to you, having somebody in the room with you, why does that all of a sudden go from feeling like you can't get anything done to finally being able to get something done?
So I think you're using the executive functioning of the body double to help this person with ADHD. Right. And this is a strategy that can be used in the classes as well. So for example, this kid struggles with let's say, taking the notes or like remembering when to do things and like making a timeline of things. So if you pair them with a buddy at school who is well organized, then this kid can use that buddy to stay organized.
Talking about how it's hard to get things done because you don't understand time concept. Everything looks, where do you start? It is exactly it. I want you to know my family is extremely patient with me. They have learned to be extremely patient with me. But what I have learned to do, and, minimizing the time for a child, definitely, but, because I am 36, so my clock is set to an hour. And what I've started doing is setting the timer for an hour. And I'm just going to I'm not even going to choose a place to choose a specific thing to get done. I'm just, whatever I have to do in that one room, I'm going to give myself 1 hour, and I'm not going to stop until that clock goes off, even if I don't even know where to start. And I don't know what it is, but I get it done. Whereas if I don't, and so like with a kid, I guess with this room, you could do like a 5-minute timer. But I will tell you, after that timer goes off, I take a break. I go and I do something, and whatever I want to do. It's 1 hour on, 1 hour off. 1 hour, the timer gets set, and I do whatever the heck needs to get done in that room for 1 hour, or with work,
And the strategy that it teaches is having as many clocks at home as possible. So I do this for myself. I keep like a clock in every 1 or 2 clocks in every room, so that like anytime I feel like I'm a little lost, I'm getting distracted, I have the clock there to keep me on time. In my patient appointments, I get sidetracked and I just like keep talking and I run over the time. So I have a clock right in front of me to remind me that like, okay, time to wrap up. So the time blindness is very real. So timers, there's something called as Pomodoro timers. You can download an app on your phone and you can just set up like how many minutes or you want to start engage in a task. So it will run the timer for 15 minutes followed by a break. That's exactly the strategy that you're talking about.
And I think too with kids, if you do that, it's going to take a lot. When you do your timer, time on, time off, time on, time off, yes, it's going to take longer to get the task done. But I would think as a parent, or just personally, it would be a lot better to have a task take longer to be accomplished than spend all that time arguing with your child, having a fit thrown, and then everybody's in a bad mood.
Absolutely.
So even though it takes longer, I think still beneficial and good.
And you were talking about the support needs. I think there are more supports that can be available in the classrooms. These kids often need a lot of supports in them, and our listeners should be aware that like they can ask for accommodations. If they have a diagnosis, they can ask for accommodations through a 504 plan, and there are so many different kind of accommodations that they can get in the classrooms, and it can be like preferential seating, sitting in the front, or like pairing with a buddy. It could be like taking movement breaks, or like some kids who are very fidgety, they ask for like a bouncy chair or a fidget toy that they can use. So there are so many different things that can be asked to help them stay focused in the classroom. And as we mentioned before, if there is a need to be in smaller classrooms, if there's a program in the school district, they can ask for that. And if there's nothing, like, and the kid is still struggling with a lot of learning problems, then I think it's time to ask for an IEP.
Why are IEPs so frustrating for parents? Why are IEPs such a struggle?
It's a very complicated process, and most of the parents do not know like how this process works. When somebody requests for an IEP and the request is submitted in writing, the school has to respond within 30 days whether they're going to complete the evaluation or not. And if they are saying no, we would not complete that evaluation, then they should be giving a valid reason in writing to the parent, like why they are refusing to do an evaluation. But if they agree to do an evaluation 60 calendar days, they have to finish the evaluation. Many schools are not doing that. That's the legal requirement. And then once IEP testing is completed and like an IEP is formulated, then there are annual reviews, and it's so much of work for the school to monitor and like monitor progress and have annual meetings and then retesting every 3 years. So naturally schools would not want to do it, and sometimes like there are just very limited resources that the schools have, so that makes it even harder. That's the unfortunate reality.
And so when parents are in an IEP meeting and the language is just so foreign. So when a parent is in an IEP and a parent wants to advocate for their child, a parent wants to support their child, they want to do everything they can, but when a language is so foreign and you sit through it and you don't even know what questions to ask because the language is so foreign, so then you leave the meeting and then it's starting to all kind of sink in, or you ask a few people questions and you've already signed the IEP. You've already signed the contract.
Yeah.
And you don't know what questions to ask and what to advocate for. And by the time you do, you've already signed it. So it's a predicament. It is hard for parents to advocate and support when they're in an IEP meeting like that. So what can parents have in that meeting? What can be done for parents to understand the IEP as it's in meeting real time and know what questions to ask in that meeting before it is signed instead of after when it's too late?
I think the process should start right at the time when the kid is tested and an evaluation report is prepared. I think at that time, the school psychologist should sit with the parent and explain the report, like what is the significance of different findings in the report and how that can be addressed. So somebody who can help the parents understand the needs of the child, whether it's the school psychologist who did the testing or some advocate who can go over that evaluation report and the IEP child, that these are the needs and would this IEP cater to those needs or not. And I don't think we can just like make a perfect IEP in the very first go, but as the process is like you evaluate the progress of the child and then have IEP meetings every year. And the thing is like if the parent is seeing that compared to the last evaluation, my child has not made adequate progress and is still struggling, then the parent should know like, okay, this is a time to advocate for my child and ask for these more services. But the problem is that the parent often does not know what should I ask more, right? So having somebody by the side who can help them ask for the right services, I think that would be the most effective.
Well, especially, I mean, parents are just learning this too. They're just...
It's an extremely complicated process. And until I became a child and adolescent psychiatrist, I had no idea how this process works. So I can imagine how hard it is for the parents to understand.
And so what resources are available in the community to come in? There's some nonprofit resources that come in and advocate for the parent. What are some resources that the parents can utilize that they may not know they can actually utilize?
So there is a nonprofit organization in Missouri, the MPACT, which not many parents are aware of, but it has like client advocates who can go to the school and advocate for your child, take a look at the IEPs. And so I think that's an amazing resource that every parent should look into.
So how is ADHD tested?
So let me be very clear on this one. ADHD diagnosis does not require testing most of the times. It is a clinical diagnosis and it is done based on a good history from the parent, a report of how the kid is doing at home, a report from the teachers, and then you make a diagnosis. So it's not a complicated process. Anyone who is trained to diagnose ADHD can easily do it. The problem is that somehow the parents have been told by people or maybe school or other places that you need to get this kid tested for ADHD. And testing itself is a complicated process depending on the availability of testing resources. Sometimes there might be wait for months or years to get testing done. So, and I wanted people to know very clearly that testing is not required in all cases. Now, only if we are suspecting something in addition to ADHD. For example, if I suspect that there could be learning disability. Kids with ADHD struggle with learning. But that does not mean that they have a learning disability. Learning disability, I'm talking about the dyslexia, dysgraphia. Only if I have a suspicion that along with the ADHD, there is a component of learning disability, I would go for a test. Or for various reasons that we talked before, we are getting conflicting report from the school, from home, and but we are having a strong clinical suspicion of ADHD, and the report is not matching up. So in that cases, I would refer somebody.
Okay.
And a good testing. And let me also say this about testing. People offering testing at different places are doing a very different kind of job everywhere. And there are websites who give a set of questions and diagnose you with ADHD, and there are people who make you sit on the computer and you complete a test and they hand out a diagnosis of ADHD. That is not typically how ADHD is. A good testing of ADHD requires a good clinical history. One session is entirely dedicated to history from the parents and how things are going at home, at school, and everything of that sort. Then there is another testing session where a variety of tests are administered that include tests for the IQ, academic achievement test, and then they compare the scores on the IQ with the academic achievement test to determine if there is a learning disability or not. And then they do various behavioral scales and other rating scales, input from parents, input from teachers, rating scales from parents and teachers. And based on the entire report, and sometimes they have to do a specific test called like a continuous performance test, which is the kind of paper test or a computer-based test where you sit and you do a task and they measure the different domains like working memory, processing speed, and then if they find problems in that, based on the entire input, they make a diagnosis. There's never one single test that can diagnose ADHD.
Okay.
And since I said that, I will also add on something very interesting about the working memory and the processing speed problems in ADHD. I want the listeners to know that most kids with ADHD have problems with working memory and processing speed. So what is working memory? Working memory is essentially a temporary memory in our brain. So if I tell you to go and grab these 4 things from the grocery store, so you're going to put that in your temporary working memory and you're going to accomplish a task and then it's out. You don't have to remember this for the next 10 years of your life. Okay. And then there is a permanent memory in our brain, which is if we met today for this podcast, and maybe 5 years later you'll remember you met Dr. Amit. So that's a different thing. I always compare this with a computer, right?
Yeah.
And the processing speed is something very similar to the processor in a computer, where you see every year they come up with a new processor, right? And the new processor is faster than the previous processor, and the working memory is similar to the random access memory, RAM of the computer, and it's the same temporary memory that computer has. So it's every year they update the RAM, and before, if you find a computer from the year 2000, you might find that it has a 512 megabytes of RAM, but now it's 8 gigs, 16 gigs and 32 gigs of RAM. So what has happened is that as the computers have become more capable, they have increased the working memory and they have increased the processing speed. So now the computer that we use now are faster than the ones that we used several years ago. So if you had a computer from the year 2000 and you start doing work on that, you'll realize it's so laggy. Right? So if you open multiple applications on that computer, it's just gonna lag.
Yeah.
And you can't open 10 different tabs on that browser there. So what you'll do is that you will slow down and you will open one application at a time, finish your task, and then move on to the other one. So this is very similar to an ADHD brain. This brain has a small working memory. You can't throw 100 things at this brain at the same time. Just give them one task at a time. Also, you cannot be too fast if you are talking to them and giving them some instructions. Slow down. Okay. So now you see how different this is. In a regular classroom setting, this is a child where the instruction is happening at a regular pace and the kid just can't catch up because the mind is not processing things at the same pace. So you have to slow down the instruction. That's the importance of a smaller setting, a more one-on-one instruction where things can be done at their pace, and you cannot just throw 100 things at them at the same time.
But I also think that's where, I'll speak for myself personally. As an adult, because I'm an adult, I am able to understand root causes of things because I'm really big on self-reflection, right? So if I am hyper-focused on something, and even if it's a thought, if I am hyper-focused on a thought and you interrupt me, it makes me angry. Yeah. I am not angry at you. I am not angry. I don't want to be angry. I wish I wasn't irritable when I am interrupted in a hyper-focus, but it's because I can't multi-focus. Yeah. And because I can't multi-focus, it's you're interrupting me. And it's oh my gosh, now I'm not going to be able to remember what I was just thinking about, or I'm not going to be, I don't know what it is, but it makes me frustrated. I am an adult and a lot of self-reflection and just understanding. It's easier for me to be I'm sorry, I just snapped at you. It's because I can't multi-focus. A thought was broke. I am sorry.
Hyper-focusing is a coping skill that ADHD people develop over the years. And this helps them in accomplishing tasks. It has a very positive role in our lives that we hyper-focus and finish things. Otherwise, we will always be not doing anything. Right?
And if you get interrupted and you get upset, but then if a kid gets interrupted in a hyper-focus, a thought, or it's very hard for them to understand why that emotion is coming because they're a child. It's very hard to understand why they're getting angry.
Now let's
irritable.
think about a kid who is hyper-focusing on a video game and you come and tell him, hey, you stop the video game, right? So you are coming and interrupting him and asking them to stop the video. Is the kid irritable now because you told them to transition from their preferred activity, or this kid is irritable because this kid was hyper focusing on something and you broke that focus.
Exactly. That's exactly it. And that can transfer into so many other things of people thinking that those negative emotions are selfish. And a lot of it is not selfish emotion. It's the way that they're transitioning. It's the way that they're wired or not able to transition, I should say. Let's talk about that real quick. If we understand root causes, because ADHD symptoms do tend to look very selfish. So when we're talking about children, as a child, how do you understand all that? So I feel like we need to give grace. So how do we do that? What is something when a child is in focus? How can we help them switch gears? What is something we can do? Is it, hey, in 5 minutes, I want you to know you're going to come off this game.
Reminders, repeated reminders. I think that's often needed for them to transition. And even if you tell them 5 minutes, for them, they are time blind. So 5 minutes for them might be like your 10 minutes, right? So in 5 minutes, you come back and they are thinking like she came back in a minute, right? So you have to be like giving constant reminders, 5 minutes, 4 minutes, 3 minutes, 2 minutes, that kind of thing.
To help them transition.
Yeah.
And also, in school, to transition from one class to another or from one subject to another. I think it's also why kids have trouble with transitioning in those spaces.
Schedules work for them. So they need to know what's coming up, what is next, what does my schedule for the day look like. So if they know that, they are in better control. Anytime you deviate from that schedule, it just becomes hard for them because there's the fear of the unknown. Now, how am I going to survive now, like with the changed schedule?
Yeah, even if it's something so simple, it seems big and it's simple. So I think, like for children, I think a way that can be, helped is to put the time schedule on a piece of paper and tape it to their desk and have the clock in their view. And so they're able to see that schedule. And I'm not just talking junior high and high school. I'm talking, younger kids don't really understand reading time yet anyway, but there are ways that we can help them in transition without having to stop the class to remind them that transition's there's something that we can do to put a visual on their desk and they can kind of periodically look at it and prepare themselves.
I think these are excellent 504 accommodations that we are talking about, and the teachers should be aware, like, okay, this kid thrives if I do this, and parent has to advocate, like, we think that my child would benefit from this. Can we include that as a part of the 504 plan? I think that's an important thing. And that's why I say that supports at school are very important. You were talking about how do we treat ADHD? People sometimes think that it's only the medications that's going to treat ADHD. But treatment of ADHD is very different. It's a multimodal treatment. Medication is an important part of the treatment, but that's not the only thing. These things that we ask the school to do, the supports at school to a 504 plan or an IEP, I think they are equally important. Supports at home with parents knowing how to deal with that, parenting strategies at home, I think that's also important.
And what are some good resources for parents to look at for researching strategies? Are there any books that come to mind, or how can we help parents develop those strategies while waiting to get in to see a psychiatrist?
Yeah, there are a lot of resources available on the website chadd.org, chadd.org, and you will find many resources on that website. But parents can always find self-help books on Amazon or other places. For behaviors, there are books like 1, 2, 3 Magic, and there's Dr. Barkley's Your Defiant Child. So those are important parenting strategies that they can learn through those books. And for self-help books on the disorganization that you see in ADHD, and there are books like Smart But Scattered by Peg Dawson, The Organized Child by Richard Gallagher, and the ADHD 2.0 by Edward Hallowell. So some of those things, parents can use those resources to learn, and all these are also available as a part of different therapies that are offered in ADHD patients. So there are different kind of therapies, like therapies to help with emotions, like cognitive behavior therapy to help with emotions, anger issues. Then there's organizational skills training that can help with the self-organization difficult, and there are parent trainings like the parent management training to help with the behaviors at home. So all these are offered to families who have kids with ADHD. Medication is an important part of the treatment, and let me just give you a very brief overview of the medications. Parents are at times hesitant to do medications for ADHD, but the unfortunate part of the ADHD treatment is that core problems of ADHD, like the focus problems, inattention, the hyperactivity, impulsivity, there's no therapy for that. So those are addressed only with the medications. There are two different classes of medications that we use for ADHD. One is the stimulant and the other one is a non-stimulant. Stimulants are medications like Ritalin, Focalin, Concerta, Adderall, Vyvanse, kind of medications that most of people have heard. These are controlled medications, and they are the first line medications for ADHD. The non-stimulants are medications like Strattera, Clonidine, Guanfacine, and Viloxazine, comes as the brand name of Qelbree. So these are like second line medications of ADHD. Stimulants are first line because they have much more evidence of efficacy compared to non-stimulants. In fact, I would say the stimulants are so effective that they have better evidence of efficacy than many of the medications that are used in medicine in general, and they have a very good track record of efficacy for ADHD. So definitely they are the first line medications. Many people are scared of doing controlled medications, and I get this question a lot from parents, like, I don't want to do medicines because his dad did medications when he was young and now he's struggling with substance use. And as I mentioned before, the normal life cycle of ADHD has substance use as a part of it, because these kids struggle initially with ADHD related difficulties, and then they develop anxiety and then depression, and then they can't cope with it, and then they use substances to cope with those feelings. So substance use is a part and parcel of ADHD presentation over the years. So they used medications early on. That does not mean that they developed substance use. They were naturally prone to substance use. In fact, there has now been evidence, like a good amount of evidence, that says that people whose ADHD was well treated with medications, they have a lower risk of substance use later in the life.
Really?
Yeah.
Okay, that's interesting. Because that is one of the things I hear a lot is, well, I don't want them to medicine. It's dangerous. And I just, what's also dangerous is a child not getting help. So with ADHD, one of the things that I forgot to mention was there is a link between ADHD and trauma. So ADHD biological and then ADHD formed because of traumatic events. What does that look like?
I think it's a very good question, and not many people are aware of this. There is a bidirectional link between ADHD and trauma. People with ADHD in general are more prone to traumatic exposures because of their impulsivity, behavioral issues, their executive dysfunction, and all that. So they just are in traumatic situations more than normal. The other link is people who have been through a trauma, they develop ADHD-like symptoms. There is a biological reason for that, and people with PTSD and trauma, they have a very active emotional center, the amygdala of the brain. So to cope with the strong emotions, like our normal coping mechanisms, the biological coping mechanisms like steroid hormones and all those are released. And over the time, when this keeps going on, the steroids help in overcoming the acute effects of the trauma. But if the trauma and the exposures to trauma continues over months or years, then prolonged exposure to steroids that brings on a variety of ADHD kind of symptoms. And these people struggle with memory issues, focusing, staying on task. So it looks very similar to ADHD. So we know that by definition, ADHD is a neurodevelopmental disorder that begins before the age of 12. And that's because the brain had a difficulty maturing. But if the trauma happens before 12, then it will definitely look like ADHD. And people of younger, they often get the diagnosis of ADHD along with PTSD if they have that. The problem is more in adults. So if somebody has a trauma after age 12, and then they develop ADHD-like symptoms, then many times psychiatrists are hesitant to give the AD because there was no problem before age 12. But the struggles are very real, very similar to what an ADHD person would. So in those cases, I think it's important to treat that. The treatment might look a little different than a regular ADHD because people who have been through trauma have more emotional problems. So if you give them stimulants, it can lead to more emotionality, more anxiety, and more depression and more irritability. So sometimes the stimulants are not very well tolerated in those people. So they might need more non-stimulants and other trauma-based therapies and all those approaches and medications to address their emotions first before an ADHD can be effectively treated.
Okay. And so with biological ADHD, that will be forever.
It's not like can't go away. So what happens is, as I said, like the brain keeps maturing, right? So it matures till age 25. So as the brain matures, some of the hyperactivity, impulsivity dies up. Hyperactivity specifically improves a lot. Impulsivity can still be there. It will present in different forms, like impulsive buying or like impulsive substance use or other forms in adults, but it will still there. In the inattention, the focus problems, they persist. Roughly 30 to 60% people carry over their diagnosis of ADHD into adulthood. And in children and adolescents, the prevalence is 10%. In adults, the prevalence is roughly 2.5%. So it's not that it just like goes away. Yes, certain things would improve, but it just doesn't go away completely. But it depends how well the brain matures. Let's say somebody's brain matures very well and like everything improves after like by age 25. So I think that's possible.
Let's switch over to autism. What is autism?
So autism, just like ADHD, is also a neurodevelopmental disorder. And this disorder affects the brain development and maturation in a way that impacts the social communication. It impacts emotional reciprocity, and it also leads to some restricted interest and repetitive behaviors, sensory sensitivities kind of symptoms. I'll explain that. So kids with autism, just because of that, the brain like not maturing in the right way, it impacts their social communication such that like they might have difficulty picking up social cues. They may have difficulty making eye contact, pointing, having a back and forth communication, and like being flexible in their thinking and responding to others in an appropriate way. This affects their like interpersonal relationships and interactions. So sometimes depending on how severe the autism is, some of the kids might just have a lot of language and communication and speech problems. So if it's too severe, then their speech might be delayed, or they might struggle with having a back and forth communication. And for subtle cases, like it would be more like difficulty picking up social cues and difficulty being flexible in your conversation. So they just want to talk about only one thing. So if they are interested in dinosaurs, they just want to talk about dinosaurs. So that kind of thing. Difficulty with emotions, picking up emotions of others. Somebody is mad at them or somebody is unhappy, sad. They would find it hard to pick it up. And having like the empathy towards others, those things like that would be affected. And sometimes they have very restricted interests. Like for example, they are just like interested in dinosaurs. So they are just like always dinosaurs, and they wear a dinosaur hoodie, and then they have a dinosaur with them all the time. And that kind of like abnormal fixation to things. And those restricted interests, or like some repetitive behaviors like spinning or like hand flapping, and other things could be like just having very restricted routines. Anything changes in their routines, that kind of throws them off. So those kind of difficulties. And sometimes they have sensory sensitivities like sensitivity to light, sound, touch, textures, food textures, cloth textures, those kind of things.
Are any of those also an ADHD trait, or are they for only?
So these are typically autistic traits, but as I mentioned before, sometimes kids with ADHD have some of those in a very subtle form. They might not be severe enough to reach a full diagnosis of autism, but 25% of people with ADHD do have subtle autistic traits, just because they have a very common origin.
But that doesn't mean they have the
They do not have the autism diagnosis, but there are definitely traits there.
So why is it hard for people with autism to make eye contact?
I think it has something to do with the social skills in general, because making an eye contact and then talking to the person, that's a social skill, right? So most of the times, like they just struggle with that, making an eye contact and having a good conversation with people. They just find it like, and I don't know, it's like it's just very odd and anxiety provoking to them to have an eye contact.
So with those social skills, I know you had mentioned that there are some videos that you can watch with your child that help them learn social skills. What were some of those?
So social skills like typically have to be taught to these kids, and depending upon the severity of autism, it might vary like how much social skills they can actually learn, just because it's a neurodevelopmental problem and it has affected the brain maturity. And like, so yes, some of that can be remediated and they can be taught some of those things, but oftentimes these kids do struggle with the oddness in their social approach. So there are social skill trainings and all programs that are available for kids with autism spectrum disorder, and it teaches them variety variety of things, like how to approach people, how to make friends, and how to date, and how to not sound odd in situations. Those kind of things. There are specific programs for who have the diagnosis, but the problem is these problems are not just restricted to autism. So as I said, people with ADHD have subtle social skill deficits, right? And we talked about that before. So what in those cases? So these specific social skill training programs are directed towards autistic kids. So there is no help available for those people who do not have that diagnosis. So in those cases, I always feel it's parents can work on that. And let's say we are watching a show together and we find something that was done very oddly by somebody in the show, right? And we can pause it and we can talk about that and kind of model for them, this is not how it should be done, this is how it should be done. That gives them the skill to work on that.
Well, I want to mention real quick. So my older brother, he has autism and he's high functioning, but there's an episode, if you go back on the podcast, it's his name's Seth Hamilton. Look for that episode. And he talks about his journey navigating autism from a young age, now into adulthood, and all of the problems he encountered and how it affected him. And was actually in high school, he was hospitalized for 2 weeks because of how badly it affected his mental health. So I would encourage you to go back and listen to that just to get a perspective from somebody who is older and to be encouraged. I think it's a very encouraging episode. But in his autism, he has taught himself and he is fluent in 7 languages. They are, and again, it goes back to what I said in the very beginning. The intelligence is so high.
So high.
But the surroundings are not conducive for that intelligence.
Yeah. I think you brought up an important thing. So many people with autism, what we call as high functioning autism, or before it was used to be called Asperger's.
That's what it is.
Right.
Yeah.
So what typical, so the autism spectrum now, what we use the term autism spectrum. So it's a spectrum. On the very lower end would be people who have severe autism and along with that, a lot of intellectual disability, have low IQ and they cannot function independently. They don't have speech, they are non-verbal. So that's the low functioning spectrum of it. And there's a high functioning end of that spectrum where the kid is amazing, has an amazing IQ, has a good language. I'm describing Asperger. But then might have subtle social skill deficits and might just sound odd to people or their peers, right? So you imagine this kid who is so smart and is so amazing with everything but struggles socially, right? That how much stressful this would be for that child, and compare that to that low functioning autism spectrum disorder child who might not care because they do not have IQ to understand all these deficits. So naturally these kids with high functioning autism are more predisposed to anxiety, depression, because they see themselves as neuroatypical compared to their peers. There's something odd about me. They constantly perceive that, and how that surviving in the neurotypical world would bring up that anxiety, and that would drive them towards anxiety and depression and all those mental health problems.
Too, something I just thought about, it's the surroundings where you don't fit in. You already feel like you don't fit in naturally, right? And then you have all this social media surrounding you and Snapchat and everybody's ability to be very cruel over it. And so you already feel like you don't fit in. And then if somebody's bullying you because of your behaviors and it's going around on social media, and it's the factors of, again, somebody asking, why are our children and youth struggling so bad with their mental health? Well, because we have 1,000 strings of that all make this blanket, and it all goes into it, and we're not tapping into everything. We're tapping into every neurotypical.
Yeah,
only
absolutely.
The neurotypicals.
The schools are not geared towards neuroatypical kids, and the thing is, you talked about bullying. I see that very often in this population, amongst the high kids, just because they are a little different, they are neuroatypical, and the kids perceive it amongst them that there's something different about it. So they get bullied a lot at school. That adds on to their anxiety and depression. And I see often these kids struggling so much at school to the point that their parents are, I think we should homeschool. So this is a very real, and kids do not know this. Kids do not know that this person is different because he might have autistic traits, and it's important for us to recognize that why this kid is struggling so much and what help we can offer, and to the school, to the peers, like educating people that this could be due to the. So also because they get bullied, sometimes you would see those things in schools here, like kids threatening, I'm gonna blow up this school, or I'm gonna shoot you, this person or that. Sometimes I've heard these kids coming to me and tell them that they get bullied, people call them school shooter, right? Even though they had not said that. So I think what the kids are perceiving is that this is a different kind of kid, socially awkward, so they kind of fit them into the stereotype of that.
As an adult, if one adult was to tell me that I was a school shooter or to be so cruel, as an adult, I would have a really hard time processing that. That would hurt. And I'm an adult who has matured and learned how to handle emotions. And I can't imagine a child who is still developing their brain, still developing their thoughts and emotions and understanding them and how to work through them. I cannot imagine how cruel and hard and paralyzing it would be for a child to be called names like that.
Yeah.
And again, we wonder why things are happening to our children and youth that are permanent, because they can't handle things at that level yet. If you know of a child who is being bullied, or if your child is being bullied, this is why we need community in our schools, why we need to surround our students and do better by them. But let's talk about how is autism treated.
I think before we talk about treating, we should also talk about how it is diagnosed, because listeners should know about that. Because I've seen this very often in my clinical practice, that sometimes parents are just not aware what should we do to have that diagnosis. They have a suspicion, but they don't know what to do. So usually the autism diagnosis is a multidisciplinary diagnosis. Like there are so many different professionals that have to evaluate the child. Usually like there are developmental screenings that the pediatrician offices do. And when they suspect somebody, they refer them for testing specifically for autism. Testing for autism is usually done by a developmental pediatrician or a child and adolescent psychologist who is trained to do the autism testings. And there are specific tools for that, like the gold standard test for that is ADOS. And there are others like social responsiveness scale, Gilliam autism rating scale. So different places do it differently, but the gold standard is the ADOS testing. And so that's how the diagnosis is made. But then most of these kids also struggle in other domains like speech. So they might need an evaluation from a speech therapist, from in fine motor skills. So they might need an evaluation by occupational therapist, and they might have like gross motor difficulties. So physical therapy evaluation and all that might be necessary. Sometimes they have behavioral problems. So an evaluation by a child and adolescent psychiatrist might be necessary, or sometimes they might have seizures, depending on like if there's some genetic cause and something that's contributing to, then they might have to see a neurologist. So again, a multidisciplinary approach there for diagnosis and treatment. So and in terms of treatment, there is no single magical medication that's going to cure autism, but again, there has to be like different disciplines that have to be involved. As I mentioned, if there are fine motor problems, occupational therapy, speech therapy, physical therapy for like gross motor problems, and psychiatrist if there are behavioral problems, anxiety is very prominent, then we can use some medications for anxiety, and like for irritability, like mood stabilizers, risperidone, Abilify, and those kind of things can be used.
So,
and then like we talked about the social skills training to help with the deficient social skills, and also independent living skills. If there's a low functioning autism child, then they need help with independent living skills. So yeah, those are the different ways in which like
are there any resources for parents? So if your child is low functioning, you're their caretaker for even into their adulthood. So is there any resources for parents to come alongside the parent as they walk through that journey that can be wearing on them? It can be mentally wearing on them. They can get tired. Are there resources to come alongside a family and help the parents, give them a break maybe? Or
I think you're talking about respite care, right? I think that some of that is available, and it's extremely hard because the parents kind of are worn out with all these like difficulties. Like there can be behavioral issues. There are so many caretaking needs that they need, so they just don't get time for themselves. So that's a huge stress for these parents, and they are kind of essentially cut off from their social lives. So sometimes respite care is necessary. There are a lot of resources that are available. There's a good website called Autism Speaks. Every parent who has a child with autism should visit this website and get resources from that website.
How can we come alongside a child with autism in some of these situations? So they lack it, but can we teach it?
I think to some extent, yes, it can be taught. And I think that's the importance of good therapy for these kids. Sometimes they need cognitive behavior therapy for their emotional issues, empathy-related problems, to develop cognitive flexibility to think. So all these things are related to each other. So a good cognitive behavior therapy, if it's a high-functioning kid, might be necessary.
Okay. So with autism, it has no between trauma. It's only ADHD that can kind of mimic. Trauma can only mimic ADHD, but autism has no link to trauma.
No direct link with trauma, but yes, there can be some presentations where trauma shows up like autism.
Okay.
So typically, when a child is developing, in the first 3, 4, 5 years, there's a critical period of development where the child learns to speak, learns these social skills, and learns how to have empathy and have an attachment bond with the caregivers. So if the child does not get this, let's say this was a family with substance use problems and the parents were busy doing substances, so the child was neglected, so they don't get that stimulation and they would not develop, they would lag behind in those skills, and when they present to your office they will look like they have autism because they have poor speech, they have poor empathy, and social communication, and all those skills are deficient. So that would look like autism, and sometimes these kids get diagnosed with autism in those cases, but I think it's fundamentally different than a real autism. So if you give them good stimulation and good so the chances of recovery are more.
All right. So we've talked about ADHD. We talked about autism, and I had some questions that were sent in for you. However, almost all those questions but one have actually been answered through what we were talking about. So the one somebody sent in, and it says, "My older brother was ADHD. But that was something mom and dad dealt with. I doubt there is much universal information, as every child is different. I'm going to skip that because it gives personal information. Fine and happy 1 second is their child, and flying off the handle the very next. He cannot sit still unless he is sleeping, and he has the attention span of a gnat. The doctor wants to put him on a medicated patch, but our insurance refuses to cover it. So he'll instead be on a chewable tablet, which is methylphenidate, and twice a day. So I'm not really sure what if any specific information I'm looking for, but I just need something to help us because we are beginners as ADHD parents. Sorry, I can't be more specific. So she's just looking for, as a beginner ADHD parent, what would you tell her?
So I think what she's describing is a child who is struggling with focusing and can't sit still. So she's describing core ADHD symptoms. And as I discussed before, there are no therapies that can help him stay still. So definitely there is a role of medications there. And I do not know why specifically patch was recommended. There could be issues with swallowing medications or something of that sort. But there are so many resources, so many different kind of medications that are available for people with ADHD, for people who struggle with swallowing pills. It could be patches, it could be medications that can be opened, the capsules opened and the content sprinkled on applesauce and then you swallow it. And there are medications like Vyvanse that can be dissolved in water or juice, and you can drink it. So there are so many different approaches that are available. And if the kid can swallow medications, then there are so many. So I must say that there are plenty of medications available for ADHD to address these core problems. They should talk to their prescribing physician and find the medication.
And so we talked earlier about their for executive function helping with a timer. What about with attention span? Is there anything in real time that she could be doing outside of, buying things or waiting for therapy that she can help with the attention span?
Yes, I think definitely we talked about a lot of those things. Like if the child has a poor attention span, then this is essentially like you can't throw too many things at this child at the same time. Like you have to be slow, you have to give one instruction at a time, ask him to do one thing, little thing at a time, not like give like 10 different things to do together. So some of things that these are strategies to circumvent the deficits of the ADHD. So those are the skills that they should be utilizing at home and also at school, and obtaining support through a 504 plan to help him stay seated. Like they can't help him stay seated, but they can provide him movement breaks so that after like every 15 minutes or so he can get a movement break and something to fidget with, like while he's focusing in the class. So I think some of those strategies can be very effectively used.
And for a teacher who has a student who is clearly ADHD, but they're working on, the parents are working on the diagnosis, working on getting the plan. As you described earlier, it could be up to 3 months before that's even, because you have the 1 month the school has to respond and then the 2 months to work through it. So it could be up to 3 months, right, before anything's even started?
So no, not necessary. So if you're talking about a 504 plan, which is essential, and I think the listeners should be aware of a difference between a 504 plan and an IEP, because people confuse them a lot. 504 plan is very simple stuff. Like it's accommodations in the regular classroom setting. So the child still remains in the same regular classroom setting. They just get those accommodations like a bouncy chair or like a movement break or a fidget toy or something that can help them stay seated and focus. And it's easy. Once you have the diagnosis, the school would just need the diagnosis, take a letter from your doctor to the school and request for a 504 plan and discuss with them what accommodations your child needs. It does not need like 3 months of wait or so. But if we are looking for an IEP, which is a more formal process, and remember, not every kid with ADHD will need an IEP. Most of them will survive well with the 504 plan. So if an IEP is really needed and a 504 plan alone is not helpful and the kid is struggling and we need a smaller setting and things like that. So in that case, like requesting for an IEP and then the 2-month period in which they are going to get evaluated and then the IEP will be set in place. So I think that's something that's a second step, not the first step there.
Okay. All right. Well, Dr. Amit, I am so thankful that you came on and talked to us and informed us of, this is what you had to say was wonderful and informative. And I hope that parents who have listened, you're encouraged. I hope teachers who have listened, I hope you're encouraged. And I hope that if you have a diagnosis, you're even encouraged and empowered. And hopefully Dr. Amit and I kind of being vulnerable about our own journey has encouraged you to feel empowered, knowing that you're not alone.
Thank you so much. It was a pleasure being here. And I will end it by saying that if I can be a doctor who struggled with untreated ADHD all through his life, then I think all of you guys around walking with ADHD, you guys can be successful. So never underestimate yourself.